Hi everyone, and welcome back to Beyond the Shot. If you're watching this video, there's a good chance you're either currently experiencing nausea on your GLP-1 medication, dreading it before you start, or you've already given up once because of it. All three of those are absolutely valid reasons to be here. Now, nausea can lead to vomiting, which is the number one reason people discontinue GLP-1 medications, and it's largely preventable or manageable. So let's go through 5 concrete strategies to help mitigate this. Tip number 1, eat smaller and eat slower. You can always eat more frequently if needed to ensure healthy protein and caloric intake. This may sound obvious, but most people underestimate just how small needs to be, especially in the first few weeks or after a dose increase. Your stomach is emptying slower than it used to. So think of it like a drain that's partially blocked. Food goes in, but it takes longer to go out. And if you put too much in too fast, it backs up and you feel awful. A practical guide for this is going to be thinking of your meals roughly the size of your closed fist. That's your new portion reference. Not the size of a dinner plate, your fist. And eat at half your normal pace. Try to put your fork down between bites and thoroughly chew your food. This is not optional at this point. It's single-handedly the most effective nausea prevention technique. Tip number 2, time your injection strategically. Most people take weekly injectables like Semaglutide or Tirzepatide or any of the brand names out there on the same day each week. The peak side effects typically hit 24 to 72 hours after injection for most people. So if you're working Monday through Friday, taking your injection on Friday means that the peak of any nausea lands on the weekend when you're hopefully home and can rest, not in the middle of your work week when you're busy. This is a small scheduling change that many people find dramatically improves their quality of life on the medication. Additionally, taking the medication at night can result in you sleeping through potential side effects. So feel free to experiment with your injection timing if you haven't already. Adjusting by a day here or day there should not make a noticeable difference in terms of tolerance, as long as you also aren't increasing dosage at those times. Tip number 3, avoid your trigger foods at all costs. GLP-1 medications seem to amplify sensitivity to foods that are already hard to digest. The big offenders for most people are going to be very fatty or greasy foods, spicy foods, carbonated beverages, highly acidic foods, and certainly alcohol. Additionally, many people report that even foods they previously tolerated became nauseating on GLP-1s. This isn't usually permanent, as it's often strongest in the early weeks of medication or after dose increases, but during that window, treating these like genuine food allergies rather than things I'll try to avoid makes a real difference. So try to keep a food log, and if you experience nausea, write that down, even if it's just on a note on your phone. Patterns can emerge very quickly, and you'll learn your personal triggers within the first few weeks. Tip number 4, ginger is your friend, when taken effectively, of course. Ginger has genuinely good evidence behind it for nausea relief, and it's one of the few things you can use freely without any medication interactions. Effective forms of ginger are going to be ginger tea, ginger chews, which are sold at most pharmacies or health stores, ginger candies, or simply just adding ginger to your diet. The least effective option is going to be ginger ale, which is typically just a lot of sugar, so we're going to want to avoid that. Also, timing matters. Have ginger tea with or just before a meal so that it can help you prevent the nausea rather than having to react to it when you already feel bad. And last but not least, tip number 5. Communicate with your prescribing provider before you give up. This is something I really want to emphasize because it's helped a lot of my patients. If your nausea is severe or persistent, please call your doctor or your provider before stopping medication. There are anti-nausea medications that are very commonly prescribed alongside GLP-1s. Ondansetron or Zofran being one of the most common. So your provider may be able to prescribe these to you to help you through these symptoms. Many people who couldn't tolerate the medication turn out to tolerate it just fine once the nausea is properly managed. Also, your dose matters. Escalating doses quickly, as some protocols literally double your dosage each time, can make things drastically worse. Whereas some providers may recommend staying at a lower dose longer before stepping up, as slower titration often dramatically reduces side effects for most people. So to wrap things up, here are our 5 tips to help avoid nausea on GLP-1s. And remember, nausea is common, but it's often temporary and usually manageable. The people who get through the first 4 to 6 weeks typically report getting significantly better thereafter. So don't let it stop you from seeing what the medication can do for you when it's combined with lifestyle adjustments and coaching. If these tips helped you, please consider leaving a like and subscribing for more videos. On Saturday, I'm going to be talking about something a little more difficult, dealing with plateaus. What happens when the scale stops moving and you're months in? So be sure to tune in for that. And as always, stay healthy and stay blessed.